Hey, my name is Haley, and today we will be talking about periodontal diseases. Periodontal diseases are mainly the outcome of infections and inflammation of the gums and bone that surround and support the teeth. Gingivitis is the earliest stage, and that is when the gums can be swollen and red and they may even bleed. Scientific research began in the 1700s. One of the earliest cases that we know of is the Egyptian mummies. Scientists were studying thousands of mummies in Egypt, and during this study, the scientists discovered periodontal disease in the corpse's teeth. Periodontal disease is commonly caused by poor brushing and flossing routines that allow plaque, which is a sticky film of bacteria, to build up on the teeth and harden. Bacteria in the mouth infect the tissue surrounding the tooth. Periodontal disease most often involves two anaerobes. The bacteria correlated with periodontal diseases are gram-negative. Symptoms can include tender or bleeding gums, red and swollen gums, loose and sensitive teeth, painful chewing, and bad breath. In the United States, 2 in 5 adults are affected by some form of this disease. This disease increases with age. 70% of adults 65 years and older have periodontal disease.
Thanks, Haley. The damage that has been done by periodontal disease can often be reversed by ridding your gums of the infection. However, if periodontal disease is more advanced, it can cause damage to your teeth and gums that is impossible to reverse without extensive dental treatments. Researchers have determined that gum disease is associated with a 12% higher risk of death. Long-term effects can consist of teeth to loosen or lead to tooth loss. Complications include recurrent gum abscesses, increase in damage to the periodontal ligament, increases damage to and loss of the alveolar bone, receding gums, and of course tooth loss. Treatment, well, having your teeth professionally cleaned at your dentist on a regular basis is the best way to avoid this disease. But there are cases that your dentist might have to perform surgery to correct the problem. Good oral hygiene, brushing your teeth regular, flossing, and using mouthwash is one of the best ways to prevent this disease. But if there are some medications, there are some topical antiseptics that can be used to destroy or prevent the growth of microorganisms on the skin that can cause this disease. And antibiotics such as penicillin can be used to kill the bacteria as well. Medical procedures include the removal of unhealthy tissue. And surgery can consist of gingivectomy or gingivoplasty. Gingivectomy is the surgical removal of the diseased gum tissue around the teeth. And gingivoplasty is the surgery to reshape healthy gum tissue, kind of like plastic surgery. It's a corrective surgery procedure. There have been recent studies, however, raising the possibility that periodontal disease can be reversed, at least in mice. We're getting there. Dr. Jonathan Ann performed a experiment at the University of Washington, Seattle, utilizing an FDA-approved drug called rapamycin, which is primarily used to prevent organ transplant rejection. He used this in his experiment with mice, and it seemed to set the clock pathway back at both the molecular and functional level, slowing the aging process down, and thereby reversing the aspects of the disease, which included bone loss. If the drug works the same way on people, it could have a big impact, since a major proportion of older adults had periodontal disease. And the reason we chose this topic, periodontal disease may increase the risk of diabetes, heart disease, and dementia. So educating people on this disease could save lives. Thanks.